The missing link device, a novel technique to balance total knee arthroplasty. After years of design and development, we were awarded 2 patents and a trademark by the United States Patent and Trademark Office. The surgical advantages of the missing link device are several and simple. A balanced knee is achieved every time. It is simple to use. There are no complex ligament releases to recall nor execute. This method avoids intramedullary violation. Therefore, there is decreased blood loss, leading to less postoperative swelling and stiffness. And finally, there is no need for special preoperative scans such as MRI or CT. Implant survivorship is correlated with evenly loading forces across the implants. However, this can be a struggle since most systems prepare the femur and tibia in isolation, then require injurious soft tissue releases to balance the knee. When surgeons resect the bone at the same angle each time, one begins to question, what then is the appropriate limb alignment? Dr. Bellemans and colleagues out of Belgium received the Ranawat Award in 2012 with a publication that examined normal knee alignment in 250 healthy men and women's knees, 500 knees in total, between the ages of 20 and 27. They found that about 1 in 3 men and 1 in 5 women had greater than 3 degrees of constitutional varus. Also, normal knee alignment in this cohort of non-arthritic knees ranged from 5 degrees of valgus to 8 degrees of varus. The challenge then becomes, how do we improve patient satisfaction, clinical outcomes, implant survivorship? The missing link device can be a part of the solution. Here is a preoperative long leg image showing over 12 degrees of varus malalignment. A preoperative image of the patient's contralateral limb reveals a native non-arthritic alignment of 5 degrees of varus. To achieve the forgotten knee, we theorize that the surgery should reproduce each patient's native knee alignment as seen here. In short, techniques that are individualized for each patient's surgery will yield the best outcomes. Recall that our goal is to create flexion and extension gaps that can be equally filled by the manufacturer's implants. Our device is open platform to be used with any FDA-approved implant currently available in the marketplace. Recall also that balanced forces equal improved implant longevity. The goal is to create a rectangular extension gap and fill it with the manufacturer's implants. We believe correct bony resections can provide a better solution when compared to the classic teaching of traumatic serial releases of soft tissues. The missing link device comes in one single simple tray. Missing link users employ the LATER technique for performing total knee arthroplasty. LATER is an acronym which is explained as a linked and tensioned extramedullary resection. The missing link device and LATER technique have no soft tissue releases, just enough for exposure. Removal of osteophytes from the distal femur and the proximal tibia, then complete the tibial resection via the surgeon's preferred method. Extend the knee, then tension both medially and laterally. Link the previously created proximal tibial resection to the anticipated distal femoral resection, thus creating a balanced rectangular extension gap. No need for navigation, electronics, nor special scans. Here is another extreme example of a patient with a so-called windswept deformity. There were no ligament releases to realign this patient's knees. The case was simply performed using the LATER method and the missing link device. With the missing link device, the previous challenge of retained hardware is no longer a problem because the LATER method is performed without intramedullary violation. In conclusion, the missing link combined with the LATER technique leads to a balanced knee every time. It is simple to use. There are no ligament releases, no intramedullary violation, decreased blood loss, and no special preoperative scans. This has been a presentation overviewing the missing link device. Contact Sterling Innovations, LLC if you would like additional information.